Hi, this is Dr. Damon Miller, integrative physician in Redwood City, California. I and Christine Roche, a Master of Public Health and certified nutrition specialist and digestive health expert, both gave a second webinar on May 6th, 2020, following the first webinar on April 29th, 2020, where we were talking about ways to survive and avoid the coronavirus. In this second webinar, we're asking and answering questions. So this is the Q&A session. Christine, she's the author of 2 books. She studied and worked with leading functional and preventative medicine physicians in the United States and Europe. She can be reached at the number on the screen. So we join now the Q&A session already in progress. Thank you.
You also see it?
I do, yeah.
Yeah, there we go. We're back. Okay. So, in the particular immune response of your body to the virus is very much linked with the kind of protection that you have in your lungs and in your gut microbiome. So what I was saying is everything is interconnected. You have a unique microbiome fingerprint, your lung health and how you're going to respond to this virus, how you're going to digest and absorb your foods. There's a tremendous protection against viral infections that you can do by looking at your gut, doing the strain-specific independent tested probiotics, and then eating in the way that I talked about, focusing especially on the types of foods that are in the handout to revitalize your body so you have the optimal chances of protection and dealing with this virus. Thank you.
Okay, thank you. And I'm not sure what that little interlude was there, but we are live and recording. If you're not seeing us, I'm just going to type a thing here to hit refresh. Hit refresh if you're having problems.
Okay, we're back now with the refresh.
Yes.
We're back now.
Okay. So again, I'm Dr. Damon Miller. This is Christine Roche. We're going to be taking questions, and people are typing their questions into the chat. That's working really well. So there's a chat function, and just there's some great questions here.
People are having issues with getting in. They're saying
I think they're back now.
Okay.
Okay. And again, if you're having trouble with this, like I say, just hit refresh in your browser. That should bring you back in. And in case it didn't get on, just the brief recap of what I had talked about. Just be healthy. That has shown that it does a lot to keep the coronavirus from being a major problem. Okay, so let's starting with questions. There are a lot of questions about vitamin D, and I'm going to just say a little bit about that. I will send out in the follow-up that's going to have the link to the recording. I'll send out a link to the podcast we did about vitamin D. There's also a paper that was written. You can download that has references. Let me just say a couple of things, because this is a big thing. One, there's a big difference between two different forms of D that are used as supplements, vitamin D2 and vitamin D3. So vitamin D2 can be toxic. I challenge anyone to bring me a documented case of vitamin D3 being toxic. And doctors often prescribe D2. So when they think vitamin D, they think of possible toxicity, and they get worried if you take the kind of doses that I'm recommending you take. So, but this isn't a guessing game. It's not a hit or miss. There's a basic safe dose that I recommend everybody take. If you're worried you're taking too much, get a vitamin D3 test, a vitamin D3 test, D3, not D2, but vitamin D3 test, and follow that to determine what kind of a dose you need. There was one question here from about whether there was a connection between vitamin D and high calcium. There are a number of things that can cause high calcium. Vitamin D can push your calcium up some, but most people that I've ever seen with high calcium is because they're taking way too much calcium. It's the cardiologists who have figured this out, that the recommendations for how much calcium you're supposed to take are way too high. So if you're taking a day of calcium and your serum calcium is too high, it's too high because you're taking way too much calcium. The vitamin D protects against heart disease, it protects against cancer, it protects against viruses. Vitamin D is a hormone that we need. There is an epidemic of vitamin D deficiency. Take your vitamin D. If you're worried about it, get a blood test. But base your dosage on your vitamin D level from a blood test. Don't base it on your calcium. And we can talk more about that. So that was a question from, I think, Diane. The other thing is, if you're taking vitamin D from other places that you're going to take too much, again, if you're concerned about taking too much, and I'm trying to tell you, you don't need to be concerned about taking too much, get a blood test. And the blood test, if you are having trouble getting access to that, email me. We can set you up to get a blood test for under $30 at LabCorp. So I'm happy to arrange that for people. The other thing that about vitamin D, one of the questions that was coming through is, if you haven't been taking it, how long do you have to take it to get a healthy blood level? And what I recommend people do if they are just starting on vitamin D is that they do a loading dose. The physicians, the physician literature says 50,000 units as a loading dose. I'm saying take 50,000 units 3 days in a row as a loading dose, and then go to 10,000 a day on average, so 70,000 a week. So let's see. Are you seeing, Christine, you see the chat, right?
Yes. Mm-hmm.
Okay, yeah. There was a question here about the D3 test. Yeah, LabCorp. And then there was a question here about the 25,000 units per pill of the vitamin D. Let me just say one thing about that. Vitamin D, because it is partially fat soluble, you don't need to take it every day. It does not run through you the way the B vitamins do or vitamin C does. You can dose it sort of every now and then, and you'll keep your blood level up. So I have people, if they're trying to take 10,000 a day, they take 3 of the 25,000s per week. That's 75,000 a week. They maintain a very decent, good blood level. You don't have to take it every day. So the purpose of the 25,000 IU International Unit vitamin D pills is you just only have to take 3 tiny little pills a week to do it. And how much calcium is too much? That was a question, since I did talk about calcium. Probably you don't need much more than a couple hundred milligrams of calcium as a supplement a day if you're eating green leafy vegetables. So Christine, you seeing any questions here that you want to take on?
A lot of it is about the D3. If people have any questions for me, they can type it in. I think the most important thing is to really reduce the sugar. As I was saying, sugar lowers your immunity within 24 hours, drops significantly. So what I would say, if people have any questions about nutrition and sugar, there are certain beans like mung beans that are very protective against viruses. Black rice is great, purple vegetables. I think EMF plays a factor in protection against viruses. If people have any questions about the gut or gut testing, I'm happy to answer it on the chat. I think the key is to discontinue all sugar and refined foods and really focus on boosting, like Dr. Damon Miller is saying, the things he's recommending, along with the best nutrition, exercise, sunlight, and of course, most importantly, is to boost the microbiome, the gut bacteria, to really work with your immune system.
Okay. And let me go. There's one question here about the seasonal effect. And, we hear a lot about the seasonal effect. Certainly we think of there being a flu season. And I don't want to say the flu, the influenza, and coronavirus, they're very different viruses, but the human response to a virus is pretty boring and consistent, whether it's a coronavirus, dengue fever, Eastern equine encephalitis, flu. The body has a limited number of ways that it responds to these viruses. So, and interestingly, not to make this too circular, but one of the best hypotheses that anybody has as to why there is a flu season. The conventional wisdom used to be, well, in the flu, everybody's cooped up inside with each other and this just gets passed around more. Well, now if you've ever been into a modern office building, everybody's cooped up with each other all year round. And still, we see a seasonality for the flu. And one thought is that there's, when the sun is higher in the sky, more ultraviolet rays reach the earth, and the body's able to actually make a little bit of vitamin D. So, I don't see a question about that here yet, but one of the things about sunlight and vitamin D is that it is very specific ultraviolet rays in sunlight that are needed to make vitamin D in the human body, and those rays are almost missing entirely almost between October and May. So I don't care if you are outdoors all day long between October and May, you're not going to make much, if any, vitamin D. So the seasonality is felt to be in part due to some remedying of the low vitamin D level that everybody has in the summertime when everybody's outside. And that's also why we see much less of fewer cases of coronavirus the further south you go, the closer you get to the equator. Fewer cases in Central America and Mexico. I mean, it's happening there. I'm not saying it's not a problem there, but there does seem to be a variance that can't be explained just by, it can't be explained by anything really. So the idea that it's due to sunlight is as good as anything. And then there was one other question here that was about hydrogen. We'll come back to hydrogen.
Also, the noni and vitamin C. There seems to be a question about what the kit is. People are saying, well, what's in the kit? Should we take noni and vitamin C? There's a number of questions.
Okay, well, yeah. So I talked about vitamin D. If you're going to do one thing, take adequate amounts of vitamin D. Keep your level high, and don't mess around with this. I mean, take enough vitamin D to keep your level high. And when I say high, at about 50 nanograms per ml. And remembering too that your blood level of vitamin D isn't linear. In other words, if you're taking 10,000 a day and your blood level of vitamin D is 30 nanograms per ml, to go from 30 nanograms to 50, you may have to take 3 times as much vitamin D. So, you just need to get started at a decent level, test to make sure convince yourself you're not poisoning yourself on the dosage that I'm recommending, and then adjust. I have people that are taking 50,000 a week and they maintain a good level. I have people that need 50,000 a day to maintain a good level. And that's partly due to, there are some common metabolic genetic abnormalities that affect our ability to handle vitamin D. That gets revealed when you try to get your dose level up. But anyhow, just the kit that we have, the virus survival kit, has the vitamin D. And so you actually take big doses of that at the first sign of any illness. It's got vitamin A. Vitamin A, there was a question about vitamin A. Vitamin A influences mucosal immunity, and the form of vitamin A that's in the kit, and the one I recommend, it's called micellized vitamin A. What that means is that the vitamin A is formulated in a way that it makes it partially water soluble, so you can take big doses of that and not become toxic. And so you're taking a dropper full of that 3 days in a row when you first feel sick. And the noni is what we recommend as a plant-based product that regulates your immune system. There are a lot of things that do that. Noni by no means is the only one. It's just worked really well for us, but people take sambuca, elderberry, they take all kinds of other herbs that regulate immune response. If you've got something and it works for you, echinacea, whatever, mushrooms, use that. But taking something that has a positive effect on regulating immune response is good. And then in the kit, there are 2 specific herbal products, Tacuna and Barberry, which are from the company Nutrimetics. And those have antimicrobial properties, so those aren't taken to prevent, those are taken should you come down with the virus, and they can be very effective. And again, when I say they're effective, they don't stop the virus in its tracks, but it keeps you from ending up in the hospital. It modulates it. Um, so those are that. Someone asked, has my kit been used successfully for people with COVID? That's a good question, because in the early days of this, it was impossible, and still today, it's impossible to figure out whether you've got COVID or not. Go try and find a test, even today. If you're feeling sick, you've got a fever, you call up Kaiser, you call up your doctor, you call up me, you call up the hospital, and they say, I'm feeling sick, I've got a fever, I think I might have the COVID virus, will you test me? And they'll ask you some questions, and if you're not that sick, they'll say, just write it out. We don't have any treatment for you, we're not going to do anything. If you feel like you're having trouble breathing or getting really sick, come on in, then we'll test you. But so I've had people who have, since beginning of March, who have had symptoms that very well could have been COVID. They've had the flu kit in their hands, they've used those things, and it's cleared up very quickly. So were we treating COVID? Were we treating influenza? I don't know. I think we have treated people successfully, but I don't know.
There's something about oxygen is getting into the blood when somebody gets into the hospital. What treatment should be requested?
Yeah, that's a good question. It has to do with and this actually relates also to the questions about hydrogen. The reason that people end up in the intensive care unit on a ventilator with the COVID virus has a lot to do with the effects that the virus has on the lungs. It's complex, but the virus causes a particular kind of inflammation in your lungs that makes them do a very poor job of getting the oxygen out of the air you're breathing into your blood. And so it's almost like you have a restrictive lung disease. Think of somebody who's been a lifelong smoker with COPD or emphysema, or even, a bad chronic asthma. Those restrictive lung diseases, they make your lungs rather rigid and fibrous, and they don't get oxygen out of the air you're breathing into your blood very well. It's also a terrible lung to have to try and work with a ventilator. Again, this is going a little bit afield, but if you are a medical doctor and you take care of a lot of people with chronic lung disease, like emphysema, the last thing you ever want to do is let them get to a point where they need a ventilator, because they're likely not going to survive it. If they get so sick that they need a ventilator, you're going to try it rather than just let them die, but it doesn't work very well. Trying to use a ventilator on a lung with restrictive lung disease isn't very good, and that's why trying to use a ventilator in COVID on people, most people, by the time they reach a point where they need a ventilator, the majority of those people are going to die. And so that's why it's so important to keep you from getting to that point. That's why it's so important to start by taking care of your health. That's preventative. Have some things on hand so if you do get it, it doesn't become a serious, terrible disease. And have those things on hand, because you need to start them right away. Within 6 hours of feeling sick, not 12 hours, not 24, not 36, but within 6 hours to really have them do the most benefit. So you don't want to go on Amazon and order these things when you start to feel sick, because that's just not going to do you any good. Now, the hydrogen, I said it was a related question. There are different pathways of inflammation in the body, and the one that COVID seems to really activate in a big way is one that activates what are called cytokines. Cytokines are what get activated in the lungs. That's what causes the fibrosis and the rigidity and the restrictive inflammatory changes in the lung tissue, and that make you need an intensive care unit and a ventilator. Some people who have underlying inflammatory disease, and there are a lot of people for a lot of different reasons. One is very common. Christine sees all the time people who have systemic inflammation because their gut's off. They have dysbiosis, they have leaky gut, they're really inflamed. They don't know it really. Well, they do sort of know it. They know they don't feel well, they're fatigued easily, things like that, but they don't they're operating at a high level, going to work every day, um, living a pretty full life. But underneath, they have a chronic inflammatory problem. That can also be, somebody who's got a smoldering viral infection, or somebody with bad gum disease, or even mild gum disease, just chronic infections, chronic stress, poor diet, poor gut health, and we haven't really talked much, but toxicity. So those are all things that are sort of a setup for you to get really sick if you get the coronavirus, and you get what's called a cytokine storm. And that cytokine storm, it just puts you over the top. I mean, you are so sick that you end up in a intensive care unit, and kidney failure and liver failure, and just trying to die. And the hydrogen turns out to be a very effective anti-inflammatory, specifically against inflammation caused by cytokines. Well, how are you going to get hydrogen into your body? You can't just have a tank of hydrogen at home. Hydrogen is a highly explosive gas. So people have worked out ways to, they make these pills that you dissolve in water. You put it in a closed bottle of water. I've got, I just put some hydrogen in this, so I dropped a pill in here. It dissolves. There's, you can hear the gas rushing out as I open the bottle. But I drink that water. I get a dose of hydrogen, and you don't need to take that all the time. Although people find that it helps with recovery from rigorous exercise very quickly. It's the performance athletes are the ones using these pills the most. But these pills you can have on hand, and there is some evidence that they defeat or that they abort a cytokine storm. So when would you, if you felt like you were coming down with the virus, you would start taking the hydrogen right away. You would probably you would use a smaller bottle than this, and probably go through 6 or 8 of those bottles of hydrogen water a day more if needed. So again, if you've got underlying health conditions, you've got chronic Lyme disease, you've got a chronic viral infection, you have an inflammatory condition, you might want to have some hydrogen pills on hand as well. And we can provide those. Let's just see what's up at the top here.
I have a couple of questions now, Damon, that I can answer.
Yes, go ahead.
Okay.
Go for it. Yes.
First of all, there's been a question of, is there still a chance of getting the special pricing for the testing? Because the answer is yes. If you order it, it's on my website. If you order it today by midnight tonight, you can still get the special pricing. It's www.digestivehealth.center. Digestivehealth.center has the webinar. You just click on webinar special offer. It's all there. The immune test, and also the more expanded microbiome test. And so yes, you can order that today. You can also email me. You have my email address, and you can, if you have any further questions. There is a question about Dr. Gundry's Lectin Shield and Total Restore. What I find is every person's gut microbiome is a unique fingerprint, as unique as they are. I am very familiar. I've studied with Gundry. So if you have a question about that, Roger, please email me, because I would want to have a personal conversation. What I do is personalize, matching up with certain supplements based on the microbiome and other things. So it's not as simple as saying, yes, this is good, because for some people things are great, and for others they don't work so well. So it's all personalized. So you can email me at roche.c@gmail.com. It's also on my website. You can contact me by clicking Contact Christine. So the next thing that also was addressed to me, and I want to mention that about Argentine 23, that was both of us, that I've actually heard from several physicians about COVID and silver and so on. Nutritionists recommend Argentine 23, and that is correct, but I want to hear Damon's input on that. I've been told, basically I use it for gut dysbiosis a lot. The test that we do actually shows which natural remedy on the test you take, shows you which one will fit for your particular bacteria. So many times Argentine works, but for COVID, that's a whole different situation. So I've heard it does not do that much for COVID. Is that correct, Damon? The Argentine 23, or is
Yeah,
that?
let me just, there was also a question in the first, this is a good time for the question that was in the first chat that we had in that first webinar, which was somebody was asking about the malaria drug and about some of the other drugs that are being done. So the Argentin is in there. Let me just say what has been looked at. So first of all, there's sort of two bodies of information on this. One is from allopathic medicine, which is really looking only at things that come from drug companies. So the remdesivir and the different antiviral drugs that have been investigated. And then there was that brief kind of laughable thing about the malaria drug, the hydroxyquinine. I say laughable because that drug is pretty toxic. You know, a good reason to take it is that you want to have your heart stop, or you want to lose your vision, or you just want to die. It needs to be carefully monitored, and all of the cases that were reported where it might have done some good were just anecdotal cases. And what I mean by anecdotal cases is that fortunately, with this virus, the majority of people don't even know they got it. They end up with antibodies to it. You know, they were exposed. Their body took it on and developed antibodies to it. But they don't. Maybe for half a day they had a runny nose. They don't even remember being sick. Then there are people who get sick and it's just sort of mild. There were a number of people. You know, we asked in the first webinar, we asked, "What do you think your odds are of getting this?" And there were a number of people who said, "Hey, I already had it. It wasn't that bad. I was maybe about sick for 5 days and then it went away." The reason that's important is that the most likely thing to happen to you if you do get infected with the COVID-19 virus is that you're going to get better. And so if you start developing a fever and you start taking Argentin 23, or you start taking a malaria drug, you start taking remdesivir or whatever, any of these things, and you get better, well, you probably would have gotten better anyway. So you need some kind of a more controlled study to really say this drug, this substance, this remedy helped me. And I just got an email today from the group that I'm with, the Academy of Comprehensive Integrative Medicine, people who work with a lot of these things. Nobody's found silver to be much use. Vitamin C has been useful, but again, it has to be started in the first 6 hours, either using intravenous vitamin C or the form of vitamin C that I really like, which has become very hard to get hold of. We do have some, but it's called Vitality C. It was developed to allow very large dosing of vitamin C without making your stomach a wreck. And it's basically sodium ascorbate, not calcium, but sodium ascorbate, like the kind you would inject into somebody's vein, and bonded in a very special way to ribose that allows you to take it out of the stomach and the gut really quick, get it into your cells really quick. You can get high enough doses of that orally to actually take a dent in the virus. The Takuna and all these other antiviral remedies have proven useful over time, including going back to the official name of this virus, COVID-19. The official name is SARS coronavirus 2, and these things that we have in the cold and flu kit are variants on things that were used in China during SARS coronavirus 1 back in 2003. And they were very effective. The people who were put on these things, nobody died in a disease that was killing over 5% of the people who got it. Somebody asked here about ozone. Ozone would work if you have access to it. You need access to an oxygen tank, an ozone generator. You could do it rectally. That would be the easiest way to do it. People do it intravenously, but that's hard to find anybody around California that's going to do that because it's against the law in California. But if you had an ozone setup, you could do that. That would be useful. And then there was another question here about a hydrogen peroxide nebulizer. Possibly. I don't know of anybody who's doing that right now, but that does have antimicrobial effects, and it does affect the lungs and the mucous membranes. So I don't know. I don't use it, and but it could be of use. But again, here's the thing. We have the things Christine and I, we have the things that we recommend, things that we've seen work. I don't want you to think that these are the only things that are going to work. So these are good questions, because I guess the thing I'm trying to say is, don't sit on your butt and do nothing. If you feel like you're coming down with the virus, do what you know to do. If you've always taken echinacea when you get the flu, and that's helped a lot, take echinacea. Take what you have on hand that you can get to and start right away. Take vitamin D, take vitamin A, do these things. There was another question here. Suzanne asked about how this is a different animal, a different virus than flu, can be much worse than a regular flu. Yes, that's true. The COVID virus can be worse than a regular flu, but the COVID virus also seems to respond to all of these things that have been worked out as ways to treat the regular flu. So again, I don't want you to think all viruses are the same. They're different, but the way our body responds to a virus, the way our body responds to a viral remedy or a viral treatment program, that's pretty standard. So the things where we have experience treating flu, which has been around forever, will be around forever, see a lot of cases of it, it turns out those things are also going to be very useful for the COVID. So do something. Don't, if your doctor says there's nothing you can do, look at them straight in the eye and say, well, what you're really saying is you don't have anything to offer me, so I'm going to go do something else. But I'm going to do something, because I know taking care of myself, taking care of my health, that's what's going to get me through this without ending up in the ICU or worse. So
I have a couple of questions here, Damon, if that's okay.
Yeah. Go ahead.
I also want to say, and then I'd like you to address how much vitamin C we should actually take of the Vitality C. Is it like 1,000 3 times a day for prevention, or how much would you say?
Okay, well, so the best data on, Linus Pauling, if you remember him, he won 2 Nobel Prizes, mostly for his work on vitamin C. 2 Nobel Prizes that he didn't share with anyone. That's unheard of. That's a record. He worked a lot with vitamin C in the treatment of disease and in maintaining health. And basically, his advice was that you need a minimum of 6 grams a day if you're going to be doing it for prevention. So that's a scoop and a half of the Vitality C. When it comes to treating something that's acute, you want to take as much vitamin C as you can tolerate without getting diarrhea. So you just start dosing vitamin C, taking it every couple of hours until you have the runs. And then you're taking too much. I've been lucky where I've been traveling and had Vitality C with me, able to take it where I'm, you get off the plane, you feel sick, you go, oh my goodness, I got something on the plane, this flight, the airport, whatever. I've got this whole conference this weekend. I can't afford to be sick. And I just start dosing vitamin C, Vitality C. And at the end of the day, I go, wow, feeling pretty good. I don't have the flu. I'm not sick. I don't have a virus. And I calculated, and I took almost 40 grams of vitamin C orally, and I don't even have the runs yet. I haven't been to the bathroom all day. So, if you need it, your body will just take it in, use it for what you're taking it for, and you won't get the runs. But once you cross that line where you're taking too much, then you'll get the runs.
So thank you, Damon. I just want to clarify that when people ask what is the test that I'm offering, I want to clarify that.
Go ahead.
Yes, the short test that Betsy took, that is only the test of your secretory IgA for the 197. That does not measure your microbial fingerprint. That's one part of the expanded test. For the 397, you get everything. You get digestion, absorption, how you're processing your food. Do you have enough enzymes? Which ones you need? Are you digesting your fat? It has complete panels of digestion, absorption, and also all your inflammation panels and your complete gut bacteria and where you're missing bacteria. So that people know for the 397 you get everything without the parasitology. Some people have added that on. They've contacted me and I've said yes. For $100 you can also measure parasite. So that's $100 more to measure parasite. But the 397 is the expanded comprehensive digestive analysis of every part of your microbiome and digestion. The one for 197 is only for the gut immunity. What does your secretory IgA show? It's a little snapshot of the mucosal immune tissue and how high or low it is of what you're rating are to give you some indication. So it's a very short one, and the customized probiotics would have to be, you'd have to do the 397 test. Because the first one tells you, oh, my, there's a flashing red light or yellow or green light, what's going on with your immune system. The other one tells you exactly what you're missing, what antimicrobials you need, what customized probiotics you need. So it's really easy to then go ahead with the one for 397 and customize exactly what you need. Also, someone was asking here about what happens after you take the test. What happens is that within about 6 to 10 business days, I will send you an email and we'll set up an appointment for the test results. Every single person's results are unique, so I cannot say exactly how many visits. Somebody was asking, what happens after, what's the investment of that. The investment varies. If you're very healthy, you don't need to do much. We just have one visit. If you have major issues, we may have a couple of visits, and we correct those, and you invest in whatever your health is. So that's that part. If people have more questions about the test, please call, you ask the question. Regarding the sugar, someone asked me, I've heard we should limit our intake to 20 to 30 per day in total, natural and added. Thank you for asking that, because again, not all sugars are created equal. When you're eating a piece of fruit, you're getting a lot of fiber. So the fiber slows down the insulin reaction. And when you eat the fruit with the fiber, your insulin is not as rapidly rising as it is with pastries, for example, or cereal, where the white flour, white sugar, it just skyrockets and then it drops really quickly. So what I recommend, actually staying even away from maple syrup, dried fruit, trail mix has so much sugar. It's amazing. My clients come in with their list of foods. We look at the label. Oh my God, I had no idea my yogurt had 30 grams of sugar. I always ask you, check the labels. I used to go to the stores with people and they go, oh, but I've eaten this. I love it. It has no sugar. And we go, wait a minute. There's 20 grams because there's raisins in there. So dried fruit actually is counted as sugar. So what I recommend, yes, eat whole fruit. If you have a blood sugar issue, talk to me about it, because it's not as simple as just eating the whole fruit. You need to modify. If you have yeast overgrowth, dysbiosis, you may not want to eat that much fruit, but I don't recommend you get enough sugar actually from the if you eat whole grains, or if you eat whatever's in your diet, the vegetables or carbohydrates, what you want is unprocessed food that's not in a package, not in a can, preferably. I know beans are in cans. Sometimes that's okay. But I would say basically we're not concerned about intake because you get enough sugar just by eating one piece of fruit a day. If you have yeast overgrowth, most of my clients are surprised how much yeast they have, then that yeast will feed on the fruit that you're eating. And all the parasites love the sugar and the dried fruit and the sugar and all the added things. So I just ask people, eat whole foods, limit your fruit depending on your microbiome. And I would say it's not about the grams because you're getting enough if you just focus on whole foods and fruit. So if there's any more on that, I'd be happy to answer it.
Yeah, and I think, what Christine's saying, we don't want to make it sound like what you're eating is completely responsible for getting sick, but you have 100% control over what you put in your mouth, and it can have a huge effect on your health, your immunity. And so these mindful things that you can do about sugars and foods and what you choose to eat, it has a huge effect. Just go here. There are a couple other questions here. Somebody asked about NAC, which is N-acetylcysteine. There is data saying NAC is helpful as a preventative, boosting immunity. I didn't include it in the cold and flu kit because I've seen that kit work without that. It just adds additional cost. NAC, there was another question up the way about if you have asthma, is there something you'd be taking? If you have an underlying lung disease, then you definitely want to be taking at least a gram or two of N-acetylcysteine every day, just not even about the virus, just it will make your lungs work better and heal. So if you have asthma, you want to be taking N-acetylcysteine at least 1,500, 2,000 milligrams a day at a minimum, maybe 3 grams a day at a minimum, as a preventative thing, but also because and this is published in New England Journal of Medicine, and other very prestigious medical journals, the data on how this is useful for chronic lung disease, including asthma. Another one here, Suzanne asked about liposomal C. Liposomal C is good because you can take it and it doesn't upset your gut, but you still need the big doses. So, if you're going to take liposomal C, you still need to be getting, 8, 12, 15, 20 grams of vitamin C in, which gets rather pricey with liposomal C, so the Vitality C is a little better. A question here about if respirators can cause damage, do you recommend not using it? Here's the thing. If you're a doctor in the intensive care unit and you're taking care of somebody with COVID, the last thing you want to do, because of the experience they've had of how few people do well with respirators, you only put somebody on a respirator because they're almost dead, because their lungs are so bad, their oxygenation is so bad, you're pumping oxygen into their mask and everything as fast as you can, and it's still their oxygen levels falling off, they're turning blue. You don't, if a respirator is the only other thing you have, you're going to use it, but by the time it comes to the point where the decision is going to be made to put you on a respirator or not, you're going to be almost in a point where you're not going to be able to participate in that decision. So if you don't want a respirator, you need to make sure that you've let someone know who you love who can be your advocate. And then there was one other question here. Oh yeah, about the herd immunity antibody test. I'm kind of intentionally waited till we're pretty far into our Q&A session here to say the thing that nobody wants to hear, which is right now, the approach that the world has taken to this virus is to basically not keep everybody from getting it, because the truth is we're probably all going to get it. That's just the way it is. We're all going to get it at some point or another because we have no immunity to it. It's highly contagious and it's everywhere. So you want to be prepared so that when you do get it, I'm saying when, not if, when you get it, your body knows how to deal with it. You walk around every day with the most sophisticated antiviral machinery on the planet. It's in your body. It's your immune system. You want to keep that system working really well so that when it sees the virus, it knows what to do. It will do its job, and you'll get through it the way you have through every other case of the flu you've ever had. Yes, it can be worse than the flu, but you can get through it. Most people who get this virus get through it. You want to make sure you're one of those. You're one of the people who gets the virus, gets through it. Not a big deal. The question about the antibodies and getting the antibody test. Right now, the antibody testing is pathetically poor. And I don't want to say a lot, but there's a responsible way that you develop an antibody test, and there's an irresponsible way. And there are about 90 tests on the market right now. Most of them are trash. And that's because there was such an urgency to get an antibody test that the FDA just kind of backed away and said, oh, just go for it, do what you can. And so a lot of tests came on the market, and they're just completely useless. And right now the test from Abbott is probably the best one, but even that one isn't very good. And when I say it's not very good, you get the test and it says you have the antibodies. You might as well toss a coin. Maybe you do, maybe you don't, because their coronavirus, 25-30% of all the colds, the common colds we get, are coronaviruses, and they're everywhere. And a lot of people who show up positive on the antibody test that exists now, they're showing up positive because they had a cold 3 years ago with the coronavirus, and that's what it's detecting, not the COVID-19. Getting the test isn't going to ensure that you have immunity because the test is so unreliable. So if you get the test and you say, oh, you're positive, you've got the antibodies, and you think, oh, I can just go do anything I want now, I don't have to worry, you could be horribly disappointed. So right now, I don't think getting the antibody test is good, but keep your eyes open, and when they finally settle on one and say, this one's looking pretty good, then you could get it, just to document whether you've had it. But the whole idea of herd immunity, nobody knows the real number, but it's probably at a minimum, when 60% of the population, the herd, the people in your herd, when 60% have had it, then there's not enough vulnerable people for the virus to continue to migrate around. Some people think it's more like 80%. But, whether you build that herd immunity through a vaccine or whether you build it because everybody just gets the virus and now they're naturally immune, That's the point where the virus quits being such a huge problem. But just to kind of put that in perspective, another coronavirus was the MERS virus, or the H1N1 virus, the one that was around in 2008 or something like that. So the H1N1 virus, we'll talk about that one. H1N1 is a flu. We do a pretty good job of making vaccines. We did eventually make a vaccine against the H1N1. It wasn't as bad as we thought it was going to be, but it was pretty bad. Tens of thousands of people died from H1N1. And H1N1 is still around right now this year. One of the reasons why the flu is so deadly is because it's still the H1N1 making the rounds. People who never had the vaccine, they haven't had it yet, or they had the vaccine 5 years ago and it's worn off. There's still a vulnerable population, and the H1N1 is worse than the regular flu. So, the same's probably going to happen with this COVID, is that it's going to continue to kind of circulate around every year. There's going to be a new crop of people who get it who never had it before. And that's just the way it's going to be. Yeah, so just a couple other. There's a question here, which is always a hard one to ask. Should we get a regular flu virus vaccine? It's not going to do anything for the COVID virus. It's up to you whether you want to get a flu vaccine. I find that, there have been big studies. If you look at the literature out of Britain, and again, I don't want to make it sound like the flu and the COVID, but the flu is a virus that's well studied, so we learn a lot about studying the flu. Big studies that were done in Great Britain, published in the British Medical Journal, a very prestigious journal, where they do things like take 50,000 groups that look identical. Same number of cases of the flu, same number of days lost from work, same number of hospitalizations, same number of deaths. You cannot tell the two groups apart. Same is true here. The HR department at the local Kaiser, somebody who I know that works there, reports that, in the many years that Kaiser's demanded that everybody who comes into the hospital and works there, they have to get a flu vaccine, hasn't made a difference, a dent, no difference at all in terms of the number of employees who are sick and lose work because of the flu. Same as before they started that program after. And why am I saying this? Because the vaccines against viruses are sketchy. They're not, it's not a perfect system. We've never really made a good vaccine against the COVID virus. So the people out there you hear saying we may never see a vaccine against this virus, that could be the case. SARS, which was really scary, we never developed a vaccine against SARS, still haven't. AIDS, which is another virus, not a coronavirus, but we've yet to develop a vaccine against AIDS. I guess I'm saying just don't be sitting there holding your breath, waiting for somebody to come along with a silver bullet and, take the initiative, do the things that we're telling you to do here. And no, a regular flu vaccine virus at this point isn't going to do anything much for you.
There's also a question about which form of NAC, Damon. People are asking about how to get NAC, because I know not all brands are created equal, that certain ones of NAC.
The one I like is the one from Thorne. It's just called NAC, and it has 500 milligrams per pill, so you take 2 of those twice a day or 3 of them twice a day. But there's a number of companies make a decent N-acetylcysteine. So it's not cysteine, it's NAC, N-acetylcysteine, not cysteine. And one of the things that N-acetylcysteine also does is it helps with detoxification. I did allude to toxins earlier. There was here about mental health issues after SARS in China. Yeah, we haven't even touched on that, other than to say, there's an epidemic of mental health issues probably coming from this. I mean, you've got a mental health treatment system in this country that's been crippled since the time of Reagan, really. when Reagan was governor, he basically cut all funding for mental health in the state of California, and they emptied out the psychiatric hospitals, just put everybody out on the street. And they're still, try and get an appointment with a therapist or with a professional. It's hard. And now you've got probably a whole epidemic of post-traumatic stress disorder, and all the frontline people who've been dealing with this, the ambulance drivers, the people in the emergency rooms, the doctors, the nurses, the respiratory therapists, they're all just completely stressed. People have lost their jobs. Everybody's completely stressed. I mean, it's just, we're headed towards a time of a lot of stress. So what do? We just have to take care of each other. Just be aware that it's a stressful time. Stress has negative effects on your health. Everyone you know is stressed. You're stressed. Don't pretend like you're not. Don't pretend like they're not. And reach out. Talk to people. And then, let's see, one other question. Oh, question about...
After you answer that, I'll answer the one.
Yeah, well, the case Casey was asking about dose of N-acetylcysteine for an asthmatic. I would say take 3 grams a day in a divided dose, 1,500 in the morning, 1,500 at night, anytime. Don't worry about food. There was also a question about K2. That's a good question. A lot of people talk about, you don't want to be taking vitamin D unless you're taking K2. Vitamin K present in green leafy vegetables. And K2 is a variant of vitamin K. We get K2 because the vitamin K that we eat is converted into K2 by the healthy bugs in our gut. And so if your gut is deranged and your biome is unhealthy, maybe you're not making K2. The reason I don't routinely recommend vitamin D with K2 is because it triples the price of the vitamin D. Vitamin D is very inexpensive. I mean, you can take large doses of vitamin D, and if you spend more than $1 a day, even with the highest quality stuff around, it's going to be pushing it. So, so I don't recommend K2 for everybody. It's not necessary for everybody. But if you know that you've got a gut that's out of balance, you might want to consider K2. There's no good test for K2 versus K. So, it's a question. There are some people, though, that feel they start taking K2 and they feel better. Well, pay attention to that. If you take K2 and you feel better, then take K2. But I don't think everybody needs it, and I don't recommend it to start when I recommend vitamin D. The vitamin D is so critical; it operates without the need for the K, and it can be life-saving. So that's why I emphasize the vitamin D. And Christine, what was you seeing here?
The question was from Christina. Isn't the gut microbiome constantly changing according to emotions and what you're eating? That's a really good question, Christina, because yes, under stress, it actually turns out that high stress levels can cause permeability of the membranes of the gut and also alter the bacteria in the gut. However, the reason that you want to know and get a baseline through the testing I'm offering is because you can throw all kinds of things out at food and changing many things. And when you have a good baseline, you're not guessing. You know exactly where you are and which nutrients you need and what you need to do for your stress, for your emotions, for the microbiome. So that's why you can do a lot, but it takes time too. I found that's why we do retests. People test with me, and then 6 months later, we retest if they've had a bad bacteria or they had a significantly deranged microbiome. When we got the retest, we saw that it was gone. The bacteria was gone. The microbiome was flourishing. So we had really great results. You can see it in full color, which is really motivating that it worked what you did. So that's why, yes, it is changing. However, it may take time to change, and some things take a lot longer than others, and you want to know where you're starting from and what's happening. Thank you.
Okay. Yeah, another question just again about the N-acetylcysteine for COPD or emphysema. Yeah, for any kind of chronic lung disease, probably 3 grams a day would be a minimum. And again, I'm basing that because the dosing that was done in the studies that showed benefits was about 3 grams a day, 1,500 twice a day. Okay.
Okay, yeah, this is an important one. Real quickly, yes, Betsy, gut immunity is included. That's what I want to tell people. If you order the comprehensive test for $397, it includes the test that's $197 for the gut immunity. Yes, it is included.
Okay. And then one other question here. A couple people asked well, we did go over, so again, the 5 items in the virus survival kit, basically the noni, vitamin A, vitamin D, and the two different products from Nutramedix, the Takuna and the Barbary. And Christina, you still there?
Yes, I'm here. I just
Okay.
see a picture right now. Yeah, and then I'm
Yeah.
offering two tests that got immunity for $197 and the comprehensive, and it's on the website digestivehealth.center.
Okay.
Right.
So I think we're probably good. You can always email us, and let me just see. Let me just see if I can get here to. I was hoping. Oh, I see. Yeah, I'm going to just put up our information here, contact information at the very end.
Mm-hmm.
There we go. So you can email us if you have additional questions, if you're having trouble accessing things, but that contact us. This isn't the end of our relationship together, but it is the end of our time for today. So we're going to. I just want to thank Christine for doing this. This has been a lot of fun. I've enjoyed it, and there will be an email going out that'll have a link to this, but we're also going to be sort of cleaning it up a little bit and putting it up on YouTube, just so you have, because it only sits on this platform for a few weeks, and the YouTube will be a little more durable. If you want to go back, or if you want to, please, we really appreciate it when you refer these things to other people. Help us out that way. So yeah, and also if you have thoughts about other kinds of webinars you would like, let us know. This is an easy thing for us to do. We're probably going to be in a world where virtual contact is going to be a major form of contact between you and health professionals, between us and our friends and our family. So, we're prepared to do something like this again, but let us know what you need, what you want. And I'm going to end right there. Christine, you want to say anything just to take us out here?
It's a pleasure to work with you, Damon, and everyone with us. It's been great. Please keep in touch with us. Let us know what you need, and we can meet you again. Thank you.
Okay, thank you. Bye.
Bye.